If you're dealing with significant menstrual cramps, you may be about to come across some life-changing information. And you may be thinking, well, why is a dude telling me about my menstrual cramps? And I actually used to get this question a lot when the first book that I released was on how to correct menstrual cramps. And what happened was I lost my voice for 8 years and 23 doctors couldn't figure it out, so I had to really dig for my own answers. And while I was digging for my own answers, I learned a whole bunch of freaky stuff about how the body works. And when I had a client come to me with debilitating menstrual cramps, like every time she had her period, she just had to hide under her covers in the fetal position for 3 or 4 days and could not function at all. And when I was able to help her correct that in a really short matter of time, all of a sudden, all these girls started knocking on my door. Hey, are you the menstrual cramps guy? And I just learned a whole lot about how this menstrual cycle works and how to relieve these cramps that it became such a useful information that I felt like I needed to share that with everybody. So in this video, I'm going to share the information that I use to help all these girls correct their menstrual cramps. And what's going to be really weird is that it's going to make sense to you. Are you ready for life-changing information? Here we go.
T.C. Hale is not a doctor and does not claim to be a doctor or licensed in any type of medical field. Don't be an idiot and use anything heard on the show as medical advice. This information should be used for educational purposes only, and you should contact your doctor for any medical advice. Now get off me.
So let us know in the comments how long your cramps have been really bad and if there's anything that you do that brings you any type of relief. So here's how this works. There's minerals that are responsible for allowing a muscle to contract. When you contract your muscle, there's minerals involved in that process. And once a muscle is contracted, there are other minerals that are involved in that muscle being able to relax. So the contraction and the relaxation are different processes for any muscle or tissues in the body. So one of the minerals that's crucial for that relaxation process is calcium. So what's important is that the calcium doesn't just need to be in the body, it needs to be available in that tissue level. So if you get like a Charlie horse, what's happening is that muscle is contracting, but there's not enough calcium in that tissue to allow the muscle to relax. So it cramps up and you get a Charlie horse and you jump out of bed. It feels like somebody stuck a car battery on your leg and you're using all these cuss words you didn't even know that you knew. It's very unpleasant. So what happens with our period, like I'm getting a period, what happens with your period is that this whole uterus thing is like a hollow muscular organ. So it has a lot of muscular structure to it, just like your calf might have. And every month it wants to shed its lining. And to do that, it contracts. But when there's not enough calcium available at that tissue level, once it contracts, it doesn't have the ability to relax and it cramps up really bad and you're screaming and in miserable pain. So this is the reason that one girl will have her period and never really notice anything, and the other girl is in horrible pain and wants to punch people in the face when they ask her to pass the butter. So it's not about the girl, so to speak, it's about the level of calcium available at the tissue. This is the huge piece of information. And what we're going to understand in this video is why wouldn't there be enough calcium at the tissue level? Why would one person have enough calcium and the other person wouldn't? Because it's not always about, oh, I need to supplement calcium if I don't have enough. You may have plenty of calcium in the body, it's just in the wrong place. So the first step you can take is use some supplements that can help out. And keep in mind that most people are not going to find immediate relief. If you're knee deep into cramps, this might not bring you some relief in the next hour. But if you can set yourself up before your period shows up and make sure calcium's in the right place, then you find yourself having a more pleasant period. Did you know that that was even a thing? It can really be a thing. So some supplements that can help. One is lysine. This is an amino acid that's really good at helping push calcium back down to the tissue level. And a person might take 1 or 2 capsules before breakfast and before lunch. And that can sometimes be enough to create some improvement for some people. Another supplement that can help push calcium back down to the tissue level are omega-3 fatty acids. Now, we're not a big fan of using a lot of omega-3 fatty acids like everybody else is, and we'll put a video in the description below this video, a link so that you can check out our video on who should stop using omega-3 fatty acids because they can create a lot of problems for some folks. And even though we don't view omega-3s as the best answer long term for most people, if menstrual cramps are the worst thing in your life, maybe you can use them now to get some relief while you're working on some of these underlying causes that we're going to talk about next. You may also need to supplement with a little bit of calcium and maybe even some magnesium. Magnesium can be important in helping calcium get to the right place. But I find that most people don't really need to supplement with a lot of calcium. They usually have enough calcium, it's just in the wrong place. So these steps can be helpful for some people, but what seems to be the biggest thing to help most girls is to stop doing the wrong things or to correct the problems that are causing the body to pull too much calcium out of the tissues. There's a lot of things that can cause the calcium to be pulled out of those tissues. Now, the biggest problem for most people is too many carbs and sugars. I know, during your period is the time you really want the carbs and sugars, right? Well, there's a lot of resources that need to be used to complete that menstrual cycle. And when you're using up all your resources, it can magnify cravings. So if you are having cravings for carbs and sugars, I'm going to put a link in the description below for our video on understanding cravings, because you can correct that issue. Yes, even during your period. I know that for a lot of you that's just going to sound like that could never be a true statement, but you really can fix it when you understand what's creating the problem. But the problem with carbs and sugars is that calcium likes to follow sugar. Just like we all like to follow the ice cream truck when we were 9. Calcium likes to follow sugar. So when you're consuming too many carbohydrates that turn into sugar, or too many sugars, or especially liquid sugars like alcohol or soda and that kind of stuff, liquid sugars hit your body even harder. But when you consume too many carbs and sugars, that causes the calcium to want to follow that sugar. When the calcium leaves the tissues to follow that sugar, when the sugar burns up, then the body just kind of deposits the calcium in the wrong places. So reducing carbs and sugars is a really big deal and can be necessary to really create a lot of improvement for menstrual cramps. Now, we're going to come back to this carbs and sugars thing in just a minute. I'm not going to leave you abandoned there and just tell you, hey, just stop eating it, because it could cause some problems for you as well. But the next biggest thing is too much sun exposure or supplementing with too much vitamin D. I know, everybody can't shut up about, yeah, you got to cram a bunch of vitamin D in your body, but it can be problematic. So vitamin D is really crucial for us. It actually helps us pull calcium out of the intestinal tract into the bloodstream so that the body can use it. So you really got to have some vitamin D in order for that to happen. It's really important. But when you take too much vitamin D, like so many people are telling us to do now, that excess vitamin D not only pulls calcium out of the intestinal tract into the bloodstream, it pulls calcium from everywhere, out of our tissues and even out of our bones, and holding it into the bloodstream. So if you're taking too much vitamin D, you can magnify these cramp issues. So one thing you can do is you can get some urine pH testing strips. You can find these at most health food stores or on Amazon. And you can test your urine pH at least 2 hours after a meal, but don't do it first thing in the morning. And if you're having menstrual cramps that are bad and your urine pH is over like 6.1 or 6.2, anything higher than that is a really strong indication that you're pulling too much calcium out of the tissues, and then the body's trying to get rid of that calcium somehow. So your body tries to pee it out, and that alkaline calcium can raise that urine pH. So if you're seeing a high urine pH, that can be a really strong indication that you're taking too much vitamin D if you are taking vitamin D. The third most common cause is what we call an anabolic imbalance, and the body's supposed to shift at the cellular level from what we call a catabolic state during the day and an anabolic state during the nighttime, so that we can rest and rebuild and repair and all that kind of stuff. But people can kind of get stuck in one state, and a person stuck in that anabolic state will often pull too much calcium out of those tissues and pee it out. So I'm not going to go too deep into that right now, but I'll put a link in the description below this video on our video on understanding an anabolic imbalance, because you'll want to check that out if that appears that it could be a problem for you. And the next issue is a lack of resources, and this is one of the most common problems. Because if the body doesn't have the minerals and the nutrients and the resources that it needs to function correctly and run all the processes that it needs to run, well, it's going to shop at the 7-Eleven, and you're the 7-Eleven. So it'll break down tissues, it'll break down bones, it'll pull nutrients and minerals out of those tissues and bones so it can use those to function. So if your body is not getting all the minerals and nutrients it needs, it's going to pull them out of the tissues, and when it pulls these nutrients out, calcium will come with it, and when you use up these nutrients, the calcium will just get dropped and get deposited in the wrong places. So the most common cause of someone not having enough minerals or nutrients in the body is digestive malfunctions. So when we eat food, we really need to break that food down correctly so that we can bust the food apart and pull all the nutrients out of that food. That's why we eat food, to get the minerals and the nutrients out of that food. So one thing you can do is you can just look at your blood pressure. And if your systolic blood pressure, which is that top number, is lower than 112, that's a really strong sign that there's not enough minerals in the system to allow the body to function the way that it wants to function. And you can get a blood pressure cuff at the pharmacy for $30 or $40, and you can just check this on your own. You don't have to wait until your next doctor appointment to see what your blood pressure is. And just know that if you're on any type of antidepressants or anti-anxiety medications or some other medications, also have the ability to make your blood pressure look higher than it really is. So if you're on one of those medications and your systolic blood pressure is, 115, don't say, oh, well, it's in a good range. It's actually the medication that can often be making it look like it's in the right range. So this is what you want to look at. If you're dealing with any digestive symptoms at all, like burping or bloating or acid reflux or constipation or diarrhea or nausea or even skin or acne issues, all of these are really strong signs that the digestive process is not working the way that it's supposed to work. And my book, Kick Your Fat in the Nuts, can walk you through figuring out which aspects of digestion may not be working correctly, and if they are, what steps you can take to correct those. And the book is available on Amazon, but I'm going to put a link in the description below this video so you can get the whole thing totally for free. And the book that I wrote on menstrual cramps, Kick Menstrual Cramps in the Nuts, also talks about that, but it was the first book I wrote, and it was a little more complicated and hard to follow. So the weight loss book actually will help you understand how to fix any digestive malfunctions, and it will also help you understand how to eat in a way that will allow you to keep the blood sugar on a more even keel and stop pulling so much calcium out of the tissues. Because if your mineral levels are low and you try to reduce all of your carbs and sugars like we talked about in the beginning, you're going to be a little bit miserable. You're going to have issues like cravings and maybe even depression and anxiety and insomnia and dizzy spells. A lot of issues that can happen when someone's minerals and blood sugar both go low at the same time. So the book kind of helps you understand how to eat what we call medium carb foods and give your body the carbs that it needs to function without creating these huge spikes and crashes in blood sugar where all the problems happen. That's when the body's going to be like, all right, I got to shop for some nutrients and some minerals, and I'm going to pull them out of the tissues, and then all the calcium starts coming out of the tissue. So, the steps that we talked about in the beginning, the lysine and the omega-3 supplements, and those can help, but these steps that stop the problems are the ones that really bring the greatest long-term relief. And there are other causes of menstrual cramps that are possible, but these are the issues for 95% of the cases. And most of these girls need to find a way to help get more calcium into the tissues and keep the body from pulling it all out. And if you hate to read, we also have a totally free digestion course that'll walk you through the same steps as the book and understanding how to look at your body chemistry and your blood pressure and the pH to see where calcium might be going. And that'll be totally free too. We'll put a link to that free course in the description below this video as well. For now, if you already know that your blood pressure is low and indicating that minerals are probably low, jump over and watch our video on how to boost mineral levels and gain some more insights there. I can't wait to hear about your results.